Health statistics for our kids aren't moving in the right direction. At least 35% of kids are overweight or obese, that number more than tripling since the 1970s. Autism prevalence has gone up 317% since 2000. At least 10% of the kids in the U.S. have been diagnosed with ADHD, another 10% have anxiety. Rates of kids with life-threatening allergies, asthma, and even childhood cancer are all rising. I'm guessing that no parent listening would want their kid to be a part of one of these statistics. But what are we doing to ensure that? Today, pediatrician Dr. Joel Warsh, known as Dr. Gator, joins me on the show for a chat about what our role as parents is in the midst of these health challenges for our kids. He'll share tips for raising healthy kids, dietary recommendations, and some encouragement for parents who might be feeling overwhelmed by all this. Before we jump in, I want to give a quick shout out to a 5-star reviewer that said, "I just listened to Brooke Herbert's episode and loved how Melissa helped us get tangible tips from Brooke's story and feel empowered even when we aren't heard. Very powerful. Thank you." And thank you for that amazing review. If you have a sec, leave your review and come back and listen for review shoutouts. Welcome to the Daily Wellness Podcast. I'm your host, Melissa Meredith. I've led my family on a transformative health journey for over a decade, and now I help other families do the same. So this is a place where you can learn about healthy living and take the next step in your wellness journey. Dr. Gator, thanks for joining the Daily Wellness Podcast.
Thanks for having me on. I'm excited to chat.
Yeah, do you mind introducing yourself?
Sure. So a little bit about me. I'm an integrative pediatrician, and I guess what that means is I did all the regular training in Western medicine, but I got a little bit frustrated with the regular system, and so I started learning about natural medicine and alternative medicine. I'm not against Western medicine at all. I just think that there's a time and a place, and I feel like these days we're so focused in modern medicine on treatment, and there's not enough discussion and focus around prevention, and we're seeing a chronic disease epidemic, and so these things are all coming together. And so to me, I really just wanted to blend the best of both worlds and see what we can use for kids that is has some evidence and is natural, as well as using modern medicine whenever that's reasonable and against antibiotics. Sometimes you need them, but I just try to minimize using them as much as possible, things like that.
Yeah. So you've given us a couple ideas already, but what would a visit look like to you? Like, how would that look different than going to a conventional doctor?
I think a lot of it is very similar. It's just more in the mindset. So I think that, there definitely is more discussion around preventative items such as diet, nutrition, exercise, sleep, toxins. I think we certainly focus, and I focus on thinking as much as I can about root cause. So not just about treatment, but sometimes you need a treatment. So a kid comes in for ear pain, let's say. They might need an antibiotic, they might need a medication, but what other alternatives are there? Can we start with some ear drops? Can we start with something natural? And we, can I give them a prescription and say, hold on to it for a couple of days and reach out to me? And if a kid's having ear infections all the time, then maybe we can have some discussions around why. So a lot of it is similar, but it's really just a mindset of trying to dive a little bit deeper when it makes sense. Sometimes it's just a regular old checkup, but I think at least, especially because my office is a little bit more integrated minded and people are seeking me out in that way, they have more questions around what they can do in terms of their lifestyle, which I think is very important because we just don't do enough of that today in modern medicine.
Yeah, I totally agree. And I saw something the other day that was talking about how conventional medicine doctors tend to kind of wash their hands of thinking of why their patients are having problems to begin with. So that's one thing that just in what how you were describing your practice really stood out to me, is you're asking the curious questions about why these things are happening in the first place.
Yeah, I think it's diving deeper. So, first of all, pediatricians are not bad people, right? Of course, like these people that use the medicine to take care of kids, and so everybody's doing what they've been trained. But the reality is, what we've been trained in medicine is pharmaceutical medicine. Yeah, you are thinking about why in terms of like, okay, this kid has got ear pain. Well, what's the reason? But a lot of it is not thinking about the why in terms of a root cause. So if a kid has an autoimmune condition, then why do they have that? Is there something they could be doing? Is there something in their environment that could be causing it? If they coming in, with multiple ear infections, is there something that they're doing in their lifestyle that's creating this, causing this, affecting it. That's not usually the discussion. It's more, you have the ear infection, so here's how we treat it. And the why is like, oh, you have the ear infection, so we need to treat it, as opposed to, well, why did you have the ear infection in the first place? Which you can't always figure out, but I think it's important to think about.
Yeah, it's a good clarification. So in 10 years, I mean, that's a long time to be helping kids. What are some of the main problems? Like, what are you seeing the most of in kids right now? What are they coming to you for?
I think that there's kind of two avenues to look at that question. I mean, as a pediatrician, you're always seeing the common things being common: ear infections, coughs and colds, or runny noses and stomach bugs. So I think that's still going to be the most common things you're going to talk to patients about. But what I'm seeing a lot more, and that's kind of catching up in terms of frequency and what we're dealing with a lot more, is chronic disease. So things that are daily issues for children, like eczema, allergies, autoimmune conditions, obesity, diabetes, mental health concerns. We're just seeing a lot more of all of these things, and it's really just an explosion. I mean, around 50% of kids have a chronic disease at this point, which is staggering and crazy, scary, and it shouldn't be like that, but that's where we are. More than that in terms of adults, and most adults have a chronic disease. Most adults are on multiple medications at this point. And that's a big issue. I mean, that's a failure of medicine, and we're moving in the wrong direction. And life expectancy is going down for the first time in a long time. So there are some things that we need to course correct on, I think.
Yeah, I agree. That is staggering. I agree. It should not be that way. And kind of to go with your own question of figuring out why these things are happening in the first place. Like, what are some things that you've deduced that you have seen over these 10 years that's really causing those chronic disease numbers to rise?
I think the first thing with that question is just to think about the question in general, right? I think it's not asked enough. Right? We are not asking why. We don't necessarily know specifically why. There are certainly some things that are contributing to it, and I have theories, and that's why one of the main reasons why I even wrote my book in the first place, Parenting at Your Child's Pace, was because I wanted to discuss some of these things. I wanted to answer the common parenting questions that parents have in the first couple of years, but also talk about health and wellness and get ahead of this. Because if we're seeing 50% kids have a chronic disease, that means if you're having a kid today, or two kids, one of them's going to have a chronic disease, which is crazy, right? We don't want that. So I want to have help. I want to help parents think about what are the things that they can do to potentially prevent that, make their kids as resilient as possible. And that's really the way that I start the book in the first place. That's the introduction chapter, which we really talk about stress in terms of de-stressing parents from all the crazy things that they're seeing online, at number one. And number two, really focusing on what are the everyday things that you can think about that you have a lot of control over it. And I call it the seeds of health. So stress, environment and toxins, exercise, diet, and sleep. Those are the really the big factors that you have a lot of control over. And especially if I'm going to focus on any categories, it would be the toxins and the food. I think those are the two areas where we have the most control, and we can make a huge difference in our families' lives just by being mindful of everything that we're purchasing, being mindful of the foods that we're feeding our kids, reading labels, thinking about all the chemicals, and trying to minimize those as much as possible.
Yeah, I have followed you on social media for a while, and you do a great job of educating on there in such a positive way. And I know that you talk about parenting a lot. You have your parenting book. And so that is one thing that I really wanted to pick your brain about today is, what is the parent's role in this health and wellness aspect of their kids' lives? I don't know any numbers specifically about, parents that really think that they are responsible and are taking an active responsibility for their kids' health and wellness, and parents that just, I don't know, maybe just think that their kids are magically going to be healthy, if they're going to their well checks every year. I don't know what the stats are there, but what are your thoughts about the parents' role in all of that?
Yeah, I don't know if we have proper stats on it, because you'd have to be asking the questions to it's in the first place. But my biggest concern with where I've seen things go with kids and health and the media is it seems like it's being pushed away from parent and responsibility. I feel like it's like, oh, this is just the way that it is. Oh, it's just genetics. Oh, it's just what's happening. And a really good example is autism, right? I think that you see the statistics, which are absolutely staggering. A few decades ago, was like 1 in 10,000. Then it was 1 in 150. Then it was 1 in 50. Then it was 1 in 32. In California right now, it's 1 in 22. So it's staggering how fast things are increasing.
Mm-hmm.
And yet a lot of what you hear is, oh, we're better at diagnosis. It's just our genetics. It's just something that's always been here. And for sure, we're better at diagnosis, and that's a good thing. I mean, that certainly contributes to a lot of this stuff that we're seeing in terms of a rise. But it doesn't, in my opinion, explain the vast majority of it. Things are happening. We're doing stuff. And it's not to blame parents, but I feel like we're in this society where it's this blame, shame kind of thing, which doesn't help the kids. There is something going on, and there is some ownership that we should have as families, and we should be figuring out what it is that we can do and what our part is. It doesn't mean that you caused your child's autism or you did something, but if we don't acknowledge that our lifestyle and the things that we're doing are contributing some of these conditions, it's not going to change. It's not going to get better, and we're not going to be able to figure out why. And so even if, let's say it was something in your home, there was lead or something that happened to be, it's not to blame a parent. It's to make them aware, well, you need to check if there's lead, because that could be the thing that could be creating this problem. But right now, I don't see that happening. I see a lot more discussion around kind of pushing it away from what responsibility we have. And I think that doesn't help anybody. I feel like we need to take control of whatever we can take control over and try to give them the best chance at health. Because that's what our job is as parents, right? It's my job as a parent. That's my job as a pediatrician, is to help people to have the best chance to be healthy. Because you can be the absolute healthiest person, marathon runner, whatever, and you can still get all sorts of diseases. And you can be the least healthy person and smoking every day and doing whatever you want and still live to 115, right? So these things are possible, but they're not the norm. Our job is to make our kids as healthy as possible, make them as resilient as possible, do all the things that we can do to keep them healthy, and then hope that they will be healthy. And that's where it comes back to my seeds and kind of the foundations of what we have some control over, because you can't necessarily control the air, out there, right? You can get involved in politics, I guess, and make some changes, but realistically, most people aren't doing that. So you don't have control over that, but you do have some control over the air in your home. You can get plants, you can get filters, you can do things like that. You don't necessarily have a control over the water in your city, but you can get a water filter. You don't necessarily have control over what's sprayed on the food, but you can choose which food you buy and try to pick the ones that have the least likely chance of having problems. So those are the kinds of things that I tend to focus on, because that's what you can actually make a difference on. And if you do that, then this is a long-term issue. So therefore, the little changes make a big difference over the long term.
Mm-hmm. Yeah, those are really great things to think about. So if someone is wanting to start to take ownership of their family's health a little bit more, those are the things that you would recommend that they focus on.
Yeah, that's usually where I tell people to start. I get asked a lot, like, what's the one thing that you would want people to do? And generally, if I was to pick one thing, is to read food labels or just read labels in general.
Yeah.
You don't have to have a PhD in science to know that whatever long word on there is probably not good for you. You don't have to know everything. It's just good to start getting in the habit of turning over the label, looking at what's on there, look at how much sugar, look if there's dyes, look if there's chemicals. If there are words that you don't know what they are, assume it's bad and don't buy that thing. Buy the product where you have actual words that you know what they are, because they're actual ingredients like apples and almond and whatever, and that's going to get you a long way. And then over time, you can start learning about chemicals. You can start learning about toxins. I mean, we're lucky we have an internet, right? You can read about things, you can Google things, you can start to know about, you'll start hearing things in the media, and then you'll try to avoid things. But at the end of the day, if you just read the label, you can pick between bag of chips A and bag of chips B, and you can pick the better one. And if your kids are eating something like that every week, it adds up over 5 years. It makes a difference.
Mm-hmm. Yeah, for sure. What are some dietary guidelines that you usually give parents for their kids? Like, what kinds of things should they be really focused on in their kids' diets?
I would say the big thing is, well, number one, I'm not a big fan of like a specific diet, this and that. I'm more a fan of
same, actually.
like lifestyle. So buy real food and cook it. Learn how to cook if you're not a great chef. But if you are, then just try to go and get real food that's not in a box that's a pretty picture, because usually that's trying to make you not look at the label, which is why it's pretty. Right. And then buy food that you know what it is, and prepare it as much as you can. If you make one meal a day with your family, try to make two. If you make two, try to make four. Try to eat as much at home, within reason during the week as you can, and prepare meals so that way, if you do go out, if you go to a party, if you go to a restaurant, it's once in a while, that's fine. Yeah, I'm not an all or none kind of person. I don't think your kids should never eat a piece of cake ever again. But if they're doing this all the time, that's where you run into an issue. And if you control the vast majority of what they're eating, and it's real food, and you're buying the best quality food that you can get, and you're looking at the labels and you're avoiding the preservatives and the dyes and all the other stuff that you would not want on there, like a lot of sugar and those kinds of things. And that's going to get you a long way, because at least you're minimizing those toxins, and that's whatever percentage of the toxins that your body's dealing with, well, now that's not there, and then now your body can handle what it's exposed to.
Yeah, I think as a mom, I know that kids need healthy fat for their brains. I know that they need different kinds of vitamins and stuff, and we try to get as much of that from food as we can. But instead of stressing out about getting so many grams of healthy fat and so many grams of protein, I just figure if we're eating like a real whole foods-based diet and we're getting some variety, that it'll kind of even out.
That's my theory. Sometimes in my office, people will ask me that, like, oh, how many grams of this should I get, or how many, fat or whatever. And I'm like, don't worry about that. Just eat I think just eat a balanced diet. Eat your fruits and your vegetables, get your protein, get your fat, try to get the best sources that you can. I wouldn't focus on how, because I don't think it, like, unless you're a nutritionist, you're going to calculate it, you're going to sit there with, like, some people, maybe that helps them, I don't know. But I think realistically, unless you have a child who has serious medical issues in which you're required to track this stuff, that's not important to me. What is important is that you're eating real food, you're eating a variety of food, and you're minimizing the chemicals as much as possible. And if you're doing that, your kid should be healthy. Nobody was tracking what they were eating 100 years ago. They were just hoping to get food. It's like, so it's not the issue. I don't think that's the problem. It's not that we're not getting enough, calories. We get too much. We don't need to worry about that. I think for the most part these days, it's what kind, the quality, where is it coming from? Can you get it locally? Can you get it from a farmer's market? Can you get it from a garden? Because even the best quality food, half the time, it's not that great. You're still, first of all, like, imagine if you pick something from the garden, how many days does it last, right? Like a berry, 2, 3, maybe 5 days if you're lucky. So what are you getting at the grocery store? I mean, it had to be picked in some other country, probably.
That's true.
It's shipped across the world in a boat or a plane or however it gets here. Then it goes to some warehouse, then it goes to the store, then it sits there, then you eat it, which means it was sprayed in a whole bunch of stuff before you got it. So it doesn't mean you shouldn't eat fruits, but that's the best possible version. How do you improve on it? Go to a farmer's market, if that exists. At least you're eating something fresh.
Yeah, that's a great tip. But I've thought about that a lot, like how long produce has taken to get to me. And I try to grow some food to, like, one so my kids can kind of see where their food comes from and stuff. But man, not only is it probably more nutritious, well, it definitely is more nutritious to eat more fresh, but it tastes so much better too.
It's night and day when you grow something or you eat something fresh. If you go to a farm, a lot of the food you can't even recognize it. You're like, wait, what? Like, that's what that's supposed to taste like,
right? And I'm just thinking your kids might be more likely to eat some of that stuff if you have that fresh version that really tastes great.
Right. A lot of times, the food that they're eating is sprayed in a lot of stuff. So they're not eating it because it doesn't taste good, because your body naturally doesn't want it, because it has pesticides, it has chemicals, it's been sitting, it's not fresh. And there is such a massive difference in the nutrition level between something that's picked fresh and something that you're eating later. And then there's also a huge difference between eating food from a place where the farming is done properly and regeneratively versus a mass-produced farm where some things, you look at some research and it's like an orange has 1% of the nutrients it had several decades ago, or 10% or whatever. It doesn't depends on what you read. But basically the moral of the story is the food that we have today is nowhere near as nutritious as it used to be. Obviously, because we're mass producing it, so it doesn't have the chance to grow naturally and doesn't get things from the soil. It's just kind of made from pesticides and fertilizers, and so it's kind of pushing it out so you can get more and more crops so they can make more and more money. But with efficiency, you always lose something, right? It's good to be efficient. It's good to feed everybody, right? Those are good things. But we lose something with that, and you have to recognize that as a parent, as someone who wants to keep their own kids healthy, that if you're eating and doing the same things that we're doing in the Western lifestyle, then your kids are going to get sick. Like, that's the way that it is right now. So you have to be mindful of some of these things and do some of them differently if you want a different outcome. And things like going to a farmer's market and planting some of your own food, these things are not overly difficult if you live somewhere where they have these things. but it does take a little bit more time and a little bit more effort, but there's nothing you're going to get that's a better bang for your buck than that. And it doesn't mean you have to do it always, but at least, just like you said, like at least you're getting a couple things from the garden. At least they're learning about gardening. At least they're touching the soil, maybe. At least they're picking something up. They know that food doesn't come wrapped in plastic in a container. It's like it actually comes from a farm. Most kids don't even know when they've never seen it.
Yeah, very true. Sleep was another foundational thing that you mentioned, and I know that can be a big issue for parents. Can you connect the dots for us about sleep and health for our kiddos, and then give us some tips for parents that are struggling to get their kids a good night's rest?
Yeah, so just as a bird's eye view, sleep is very important because that's where you rest, you digest your food, that's where you're growing the most, that's where you're detoxifying the most. So it is really important. That's why we sleep, because it's so good for you, just in general. But it's a lost art form, I would say, these days, especially for older kids, because they're so stressed out. They have technology, they're on their phones, they're watching screens before bedtime, and it really is well established at this point that all of these things can affect your sleep and make it harder to sleep. So therefore, you're not sleeping as many hours, and then you're just chronically tired and not getting the restorative rest that you really need. So I think that the biggest tip when it comes to sleep is probably for the older kids, in that it's really important that phones come out of the room. So they shouldn't be sleeping with phones by their heads or by their bed, or really in their room in general. You should try to get rid of all screens at least a little bit before bedtime, so half an hour, whatever you can do, just so they can start winding down, resting, relaxing. I think that will get you most of the way, especially for the older kids. At least if you can do that and really remind them and remind yourself how important it is, and you shouldn't be going to bed as a teenager at like 1 a.m. You should be trying to go to bed at 9 or 10 or 11 or whatever. At least some sort of reasonable time.
Yeah, I feel like that opens up a whole nother can of worms with just the whole screen time issue. And kids, like, do you have some perspective on that to share? Like, what have you seen as a helpful, I don't know, like a way that parents can build some boundaries around that for their kids?
Yeah, I mean, screens are in the news more than ever, thanks to the new, Jonathan Haidt's book, where it's really discussed a lot. And a lot of what he has said are things I've said for a while, at least, to some degree. I think it is very harmful to mental health for everybody, but certainly for teens. And I am excited to see that the conversation is at least happening, because the reality is that it's very difficult for your kid to be the one kid that isn't on social media when everybody else is. But I do agree that there's no need for young kids to be on social media at all at that age. And so the more we can push that back, the better. And the more people that do that, the better. And the first thing that comes about is like, oh, well, safety. Okay, sure. So get them a flip phone. They don't need to have internet access. They can have the ability to call you if need be. And that should be good enough. And that way, at least they're not super distracted at school. They're not super stressed out all day. Even if they do have social media, they can check on their computer every now and again, but it's not a constant stream all of the time. And I think, if you're going to bridge the gap, then at least if you have an older kid now, it's kind of hard to be like, okay, well, I'm taking away your phone and you're not going to be on social media anymore. But we can start with baby steps of maybe no social media on the phones. And then we get back to no social media in general till, 16, at least 14, something like that. I mean, I think almost everybody's in agreement with that. Even kids are in agreement with it. It's just that it's hard to not be on it when everybody else is. And we need to have a wave of a movement to just be like, well, this is not very good for your mental health, so let's just not do this. Let's just not be on it till later.
Yeah, it is hard. I can testify to that. I have 3 teenagers and another that's not a teenager yet. And we delayed social media for our oldest, who's 17 now, and she has Instagram now. And so that's her thing. And then I have 2 14-year-old boys that have phones, but no social media. And so I hear it all the time from them about how they're the weird ones out and stuff. But just even without social media, it's still, the phone is still a distraction. So it's, you're going to have that battle. I like the flip phone idea. I should have done that.
Yeah, this is a very evolving topic. I think.
Yeah.
like literally now, it's in the news so much. And I think it's the conversation is being had because of the mental health disaster. Mm-hmm. And there are not a lot of things that you can link so obviously, but this is a very clear link that it's very disastrous, especially to young teenage girls, but also boys. There is a lot of stress. There's a lot more stress than there ever was, but comparing yourself to others, dealing with the stress on a daily basis of social media, dealing with some of those pressures that are nearly impossible for adults to deal with, let alone a teenager in school and going through all those things. It's just very difficult. And it's not to be like, oh, well, back in our day, this is... No, it's not about that. It's literally like social media is bad the way that it is right now. Yeah. It's not good. Like, if you use it in the right way, it's great. If you look at, if you're into architecture and you look at architecture, you're into puppies or funny videos, it can be great. It can be a great way to connect to people, but it has moved away from that and has moved towards division and anger and fighting and stress and media and the most crazy, scary things that you can do to get your attention. And that is not good for mental health. And that's where we are. So realistically, again, as a parent, if you want to do this for yourself or you want it for your family, if you want to de-stress yourself, then you have to minimize your access to that. And even if you're going to be on, you can curate your feed to be something fun. It doesn't have to be bad. You just have to get rid of all the stuff that makes you stressed out. Mm-hmm. But that's not the easiest thing to do. So it's just being mindful of this kind of stuff. And again, taking charge of whatever matters for you. It may not matter for you. It might be your social media might be totally fine. But if you are seeing your kids struggling, it's something to think about.
Yeah, and I think it's a perfect discussion to talk about when we're kind of trying to connect the dots between a parent's role in their kid's health and wellness, because a kid, even if they want a phone or they want social media, they don't understand those long-term impacts.
Right.
And so we have to be that filter for them.
Sure. And then even at a minimum, if you're at the point, like you say, okay, my kid already has social media and it just is how it is, but it doesn't stop you from having conversations with them about it, right? And like, okay, well, I'm not going to take away your phone, but we do need to talk about this because you need to understand, like, these are some of the stats. This is what's going on. Here's a mental health crisis. Like, how are you doing with this? Do you understand that the algorithms do this, this, and this? Like, even if you just explain it to them, then I think that they at least get more understanding of what's going on and reminding them, like, remember, if everything on social media is not real, and just because you see your friends having the best time in Maui doesn't mean they're actually having a good time. They might be having a miserable time, but they posted their one good photo. Like, all that stuff matters because you need to be constantly reminding them that it's not the real world.
Right. And I think those conversations need to happen on repeat too.
I think so.
Yeah. Yeah. This is a great tie-in to parental responsibilities with their kids' health and wellness. Another little thing that I had thought about when I was thinking about this topic is the comment that people will make sometimes about, you might make a healthy choice for your kids and someone steps in and be like, oh, well, they're just kids. They'll be fine.
Yeah, no.
What are your thoughts about that?
They won't. They're not going to be fine because they're not. Like, that's the thing is I think that, okay, we have to go back and look at several decades ago when the main parenting style was the very authoritarian, like my way or the highway, spanking, angry, parents, your dad's going to be home, wait for it, with it, that kind of thing, right? Like that. Yeah. That's how it used to be a long time ago for most people. And then that swung the other way into like the gentle parenting kind of movement, being very permissive, which was never really the goal of gentle parenting. Gentle parenting is supposed to be more authoritative in terms of like being responsive, setting boundaries, but not necessarily like telling people how it is, just being more mindful of your kids. But we definitely swung way too far into the like permissive, letting kids do what they want and saying like, oh no, they're just kids, it's fine, which is not true. Kids thrive under boundaries, reasonable boundaries, but boundaries they thrive with love and care and boundaries, and so we need to have those, and we need to be parents, and we have to set those boundaries. And if people think you're a little bit woo out there, that's fine. They can have their kids have chronic disease while your kids don't. But the things that we're doing don't work. It's not working. So we have things differently for our own family. You don't have to, right? If you want to do everything the normal way, that's fine. But then you have to understand the reality of where the statistics are. And, there are like huge spikes in mental health disorders, huge spikes in anxiety, huge spikes in stress, huge spikes in suicide, huge spikes in autism, ADHD, mental health, all these things. So if you want to be part of that normal way that things are going, that's okay. That's your choice, right? That's your completely choice to make. And it may not be the case for your family, but as a pediatrician and a dad, I'm trying to help people not have some of those things and to get into a place where they have the best chance to be healthier. And I think that if you ask anybody in integrative medicine, integrative health, that if you focus on diet, if you focus on sleep, you focus on stress, you manage some of these things, it's going to give you a much better chance to be healthy and your family to be healthy. And we see it all the time. We see people with chronic conditions that are reversed. We see things that people had given a diagnosis they were going to have for life and they're on medication that they lose that diagnosis. We've seen kids with autism that have the diagnosis that don't have that diagnosis anymore because they change up their lifestyle. That's not always the case. There are certainly things that are genetic and that there's nothing you're going to do in your lifestyle to get rid of the diagnosis. But either way, it still improves your life.
Yeah, I love that.
So I think it is a big deal. And I do think that we have to take responsibility for whatever we can take responsibility for and just do whatever we can. I mean, there's no downside to eating healthy, right? Like there's no downside to that. You still might get sick. Like that's not going to stop you from ever getting sick again, but it's going to hopefully help you get better faster.
Right. Yeah. And I don't know. I feel like as a parent, if I want to make health and wellness a priority for myself, my family, my kids, like there's really no one else that's going to do that for us. You know, like they're not going to learn these foundational things at school. They're not going to learn it from social media. They're not going to learn it from TV. So
you're not going to learn from medicine, right?
Yeah.
Not. Like it's not, doctors are not here to prevent disease. Not really, right? I mean,
right.
It would be nice, but you really can't do the job that needs to be done in the 2 to 5 minutes that you have with a patient in general. You're not going to spend an hour talking about nutrition. You're not going to go through their whole life. You're not there every day, even if you did. You know, even if you worked in some integrated medical practice and you took 3 hours with the patient and you went through everything, you're still not there with your family. It's still up to you as a parent to make the decisions on the day-to-day basis and to start learning about some of this stuff. And if you take control and realize that the medical system is not set up for wellness, it's set up for treatment, right? Which is good. We need that. I mean, you get sick, you need right. Pneumonia, you get hurt, you go to the emergency department, you need the MRI, you need the X-ray, fix your bone. That's great. But that is what medicine is set up for now, mostly. So if you want to have a healthy family, you want to prevent illness, that's up to us.
Yeah. So what would you say to parents who would like to start taking more ownership of their kiddos' health, but feel pretty overwhelmed by that? What would your encouragement to them be?
My encouragement would be that the first thing to do is to try to not be so overwhelmed, because there is no one way to do it, and every little bit makes a difference. And so you start wherever works for you, and you do one thing at a time, and you just slowly start to learn over time and slowly start to make changes. And the easiest and first thing, as I said before, was just start to read labels. So you don't have to necessarily go through your house and throw out everything and every chemical and go through your whole pantry and throw everything away. You don't have to do that. Just next time you go shopping, be mindful and look at the ingredients. Try to buy things that have ingredients that you know. Try to start replacing things. If you're buying, creams and lotions, read the label. You might look and be like, oh man, why am I putting this crap on my skin? Like, what is that?
Right.
Let me find something with some words that I know. And then you change it out. And it doesn't have to be more expensive. Some things are more expensive, but it doesn't have to be. Some things are cheaper. Some things are the same price and some things are more. But it's about being mindful and then getting the healthiest possible things within your budget, making small changes over time. And it adds up, because if you eat the healthier bag of chips every day for the next 10 years, well, that's whatever amount of chemicals you decrease over the next 10 years. It doesn't have to be broccoli versus chips. It's just every little bit matters. And most kids and most adults can handle the vast majority of the things that we're exposed to. But very clearly, given the statistics, we're falling off the cliff and it's too much for too many people. And so everything that you do brings your child a little bit closer to health. And hopefully that's enough for them.
Right. I love that. Practical advice, like the reading labels, because as we do that, and our kids see us do that, and, we can talk to them about why we're doing that and how we're doing that and what we're looking for, then we're also teaching them those life skills that they then take into adulthood, right?
I was literally going to say that next, because that's such a good point, is that what is our job as parents? It's to teach them, right? It's not to deprive them of sugary foods and then they have no idea that you're doing that and then they go off and then gorge themselves on sugary foods. It's to teach them, I'm buying things this way and this is what's going to cause you harm and this is the reason why. And like you're explaining, obviously at their age, appropriateness, or you're not going to go into a whole
right.
but even 3, 4, they can understand, like, this food's not good for you. This is going to make your tummy hurt. Oh, you ate a cake at the thing today and you're not feeling good. Well, that's because sugar can make you not feel good, or it can make you hyper. These are the things that you're teaching them along the way. And then as they're getting older, you're training them in thinking in that mentality of health and thinking about what they are purchasing, because it's very overwhelming and hard, because you're like, oh, well, I'm eating carrots and now this week they're telling me carrots are bad. Oh, well, I ate apples and like this stuff is on. Oh, I am eating this bag of cereal, which I bought because it's healthy and there's lead in there. It's like that will happen. But at least if you're mindful, then you're always doing the best that you can, and you're always changing and just being aware. And then you don't have to, kick yourself in the back because you're like, oh man, I bought this cereal for my kids and I thought it was healthy and they found this thing. No, you were doing whatever the best that you could. And then now you found out about this and you're going to get the other thing. And that's fine. You just do the best that you can. You don't know every ingredient and everything. And, you can't know that there's some secret bad metal in something you didn't even know. But at least you can buy the thing that doesn't have it, in theory, versus the thing that says it on the label.
Yeah, absolutely. I've been thinking a lot about transitioning my kids into adulthood since I have 3 teenagers now. And, who knows what choices they will make when they are adults. I'm not going to be able to control everything, and I don't want to control everything in their adulthood. But my goal is to give them the tools, right, and the knowledge that they are able to make healthy choices if they want to. They know what that looks like. They know how to do it. They know what to look for, and how to kind of read their own bodies and how they're feeling, and how to ask questions about their own health and things like that.
Exactly. I mean, I think that's a huge problem for our generation and for, the adults of the last 20, 30 years. It's like, we didn't learn a lot of this stuff because it was just kind of done for us. Like, a lot of people didn't learn to cook.
Yeah.
It was fast, efficient. It's like, oh, we can go get fast food. Oh, we can get TV dinners. Oh, and that was the thing that was cool and hip and like, okay, this is great. We got this efficiency. Oh, everyone's going to work. Okay, we don't have time to cook. Let's just do this. But then it wasn't really passed on. And we have to go back to some of those basics and go back to a time in some ways where people didn't have these chronic diseases. People were not having, kids were not having diabetes. Like there are things that we're doing that are much better than they used to be, but there are many things that are not as good as they used to be. And so we need to find that balance and that middle zone and say, okay, well, having some efficiency is good, but it's also good to cook. So I need to learn how to cook, and I got to teach my kids to cook, and they should be doing it, and they should be getting involved. Because otherwise, when, in 5 years, when they get out in the world, if they're teenagers, what are they going to do? They're not going to cook. They're going to have to buy fast food every day, and they're not going to be healthy unless they know how to do it.
Right. Exactly. You've given us a lot to think about. I think it's been really good. Seems like some super practical tips, and this a discussion on boundaries, I think, is going to be super helpful for a lot of parents. So thank you for your time. Thank you for sharing your knowledge. Thanks for what you're doing. I do love following you, and we kind of talked about that negativity on social media, and you are definitely a light and doing so many good things. So thank you for what you're doing and for your time with us.
Thank you. I really try to be as positive as possible on social media and just kind of say things like they are, and not shy away from the topics that need to be talked about as much as possible within reason and without trying to get kicked off of social media.
Yeah. And if people want to learn more from you, where can they connect with you?
So probably the easiest place is on Instagram at Dr. Joel Gator, or you can go check out my book, Parenting at Your Child's Pace, which you can get at parentingatyourchildspace.com, or, everywhere you can get books, Amazon, all the places, which everybody always says.
Awesome. I'll put all that in the show notes for everyone. Thanks again for your time. I appreciate you.
Thank you so much.
Thanks for listening to today's episode on the Daily Wellness Podcast. We hope that you found it helpful for your own wellness journey. And if so, we'd love for you to leave a review. Then come back and listen for review shoutouts on upcoming episodes. For more information, check out the show notes and connect with us on our website, dailywellnesscommunity.com.